So, good evening, everybody. This is Dr. Dhanashri Ratnabaki Deshmukh, and I would like to talk to you about dry eyes. This is a follow up to the video that I released yesterday. I got a feedback saying that they want all this information in English. So, here we go. So, basically, about dry eyes, it is a very chronic and a very common problem that a lot of people face. So, I just like to give you some basic information about the same. So the thing is, the tear film in your eye is usually secreted by the lacrimal glands, which are present over here on the upper eyelid. And the entire tear film coats your eyeball. So it coats the white portion, the sclera, the black portion, the cornea. It keeps the moisture in your eye, it keeps your eye healthy and protected, and then it goes and drains down into the medial canthus right into your nose. So the tear film is a very important part of your eyeball. The tear film is actually made up of three layers. The outermost layer is the lipid layer, the middle layer is the aqueous layer, and the innermost layer is the mucus layer. So if there is deficiency in any of these layers, it leads to something which is known as dry eye. So now let's get to the importance of this tear film. So what is the function of the tear film? So the tear film basically helps in nourishing your eyeball. So the atmospheric oxygen basically gets dissolved in the tear film and then it nourishes your cornea, the black portion of your eye. The second function is protection. So it protects your eyes against all the germs, dust, viruses, bacteria, all the harmful objects which are present outside in the environment. The third function is refraction. So it basically helps your eyes to see an object in the most clearest and in a crystal clear way. So these are the functions of the tear film. Now we come to the symptoms of dry eye. So if you are suffering from dry eye, what are the symptoms that you will experience? First is you will have a burning sensation. You will have stinging sensation. You'll feel like something's pricking in your eyes. Your eyes might become red. They might start watering because of the redness. And if this problem is long drawn, as in if it has become chronic, then you will have fatigue. So your eyes will feel sleepy. You'll feel tired all the time. Okay, so these are the overall symptoms. Now, what are the causes of dry eye? So there are a lot of causes. You can list a lot of them, but I'll get to the common few. First is your environmental factors. So environmental factors, they influence your tear film. So in case if you are in a very dry and cold environment during winters, or if you're in a very dry and hot, extreme heat in the summers, so cold dry air and hot dry air. So both of them, they basically affect your tear film. They make the tear film. The tear film evaporates quickly. So this is the environmental factors. The second is screen time. Now this has become like a chronic problem of this generation because all our work is screen related, all our entertainment is screen related. So the more the screen time, the worse your dry eye will get. Third is if you have any comorbidities, like if suppose you're suffering from hypothyroidism, if you're suffering from rheumatoid arthritis, if you're suffering from any other illness for which you're on medication, those medications might cause dry eye. Okay, so these are roughly the few causes of dry eyes. Now, what is the treatment for dry eye? The treatment for dry eyes basically is lubricating eye drops and lubricating gels, and there are a lot of other treatments also. The point of this video is so that you should not ignore these symptoms. Go to your eye doctor, seek the treatment well in time so that you can prevent further complications of dry eyes, which are you can develop a corneal ulcer, you can have infections, and the worst complication is you might even develop a perforation of your eye. So seek treatment well in time, use the lubricating eye drops, use the gels. Your doctor will examine you, he'll see exactly which layer is deficient, what is causing the dryness, and then he will treat you accordingly. Okay. The other thing that your doctor is going to advise is some lifestyle changes which you can make, which will help you in your day-to-day life. Like for example, if you've been sitting in your air-conditioned room all throughout the day, or how you can change that, or if you're working on the screen for long hours, and how you should take frequent breaks, how you should blink consciously. So he'll advise you a certain lifestyle, a few lifestyle changes which will help you. And thirdly, he'll also advise you about your diet. So your diet also plays an important part. So how you should increase omega-3 fatty acid rich foods in your diet. So basically, it's an overall treatment, a holistic approach towards treating your dry eyes. So the main intention of making this video is that don't ignore these symptoms. Seek a medical consult and follow the treatment plan which is given to you by your doctor, and so that you can stay away from all the complications. Thank you so much.